There have been several abstracts and clinical trials that have been updated at this meeting. The first one is the European Myeloma Network clinical trial on single-agent Daratumumab for stage 3B AL amyloidosis patients. Again, these patients, they have very, very poor survival, and the median overall survival for stage 3B cardiac AL amyloidosis is less than 6 months. In this clinical trial, 29 patients were enrolled, and the median NT-proBNP level was 15,000 picograms per ml, and the median overall survival when they were treated with single-agent Daratumumab has improved to 10 months. This still remains an unmet medical need because the median survival remains under a year. 24% of patients on this clinical trial did require addition of bortezomib-based therapy. The second clinical trial that is being updated at this meeting as a poster is the European Myeloma Network clinical trial of Belantamab mafodotin antibody drug conjugate for relapsed refractory AL amyloidosis. In this clinical trial, 38 patients have been enrolled, and this clinical trial, again, the important point is that the median time to hematologic response is only 9 days, so extremely rapid and brisk response. About a quarter of patients achieved a hematologic very good partial response, and the ocular toxicity occurred in about 70% of the patients. The other clinical poster session was from the Pavia group in Italy, where they looked at predictive factors for hematologic complete response in patients with AL amyloidosis who were treated with non-stem cell transplant treatment regimens. Half of the patients received bortezomib-based therapy, and 30-40% of patients received oral melphalan-based therapy. And the predictive factors were DFLC of greater than 130 milligrams per liter and bone marrow plasmacytosis of greater than 13%, which led to poorer hematologic complete response rates. And these results are very compatible and comparable to the results published by my group at Boston University with patients treated with autologous stem cell transplantation for AL amyloidosis, where DFLC greater than 180 milligrams per liter and bone marrow plasmacytosis greater than 10% were predictive for achievement of hematologic complete response.